Welcome to Health Live at Seniors Today. We are delighted to welcome here Dr. Dharitri Brahmbhatt, who is going to be talking about a very interesting topic. The topic is safe exercises for seniors. Now, in line with some of the sessions that we have had so far, and especially the last session, which was on lifestyle changes that were to be brought about, we thought it would be interesting to invite Dr. Brahmbhatt, who is a senior physiotherapist based in Bengaluru, to talk to us about safe exercises for seniors. You know, a lot of people, and some of you have also written to us, and we've figured that there are people who do exercises and they go to gyms and they have trainers, and we've had some of our doctors telling us, orthopedics, that you shouldn't do Padmasan because you could be it could impact your knees. So we thought it would be interesting to have a session about what are the safe exercises for seniors. And for this, we invited Dr. Dharitri Brahmbhatt, who is, as I mentioned, based in Bengaluru. She is a clinical and corporate wellness head at Physiotattva, which is a chain of physiotherapy clinics with around a decade and a half of experience as a physiotherapist. Dr. Brahmbhatt is a highly skilled healthcare professional specializing in musculoskeletal and sports orthopedic rehabilitation. Her vast and clinical expertise and dedication to patient care have made her a trusted name in the field of physiotherapy. She had a decade-long tenure at Fortis Hospital, which provided her with immense exposure to diverse medical cases ranging from orthopedic and neurological conditions to cardiac, women's health, and geriatric care. Beyond clinical expertise practice, Dr. Dharitri has a deep commitment to geriatric care. She has worked extensively with senior patients, including those in old age homes, providing personal rehabilitation programs that enhance mobility, independence, and overall quality of life. We welcome Dr. Dharitri Brahmbhatt. Welcome to Health Live at Seniors Today. How have
Thank
you
you so
been?
much. Thank you. So, good evening, everyone. So, I am pleased and very glad to be here today. I am honored. So, already Mr. Pradyuman has given a very, beautiful description of mine. So, I think instead of again me talking about the same thing, I'll just like to start off with the session today, that is safe exercise for senior citizens. So, I'll just share the screen so that you all, when I speak along with that, there is a something for you to refer into. So I'll just share my PPT today here.
Yeah, yeah. As always, the presentation is there, and a recording of this will be available on the website on Monday evening. So please pay attention to this. Don't have to take notes now, and post your questions to our guest today at the end of the session, and we will take it, address it. If they're not already answered in the presentation. Over to you, Doctor.
Okay, thank you. So let's begin here. So I am Dr. Dharitri Brahmbhatt. So I am representing Physiotattva today. So we are basically into physiotherapy field to help people recover and rehabilitate through the means of exercises. So I think this topic today is very much close to my heart because from a very close point of view, I have worked with many seniors as well. So now there are many questions which people face, like is it good, is exercises good for the seniors? So let's start off about, let's say, myths. There are many myths for older adults or the senior citizens or the elderly. Like, what are these myths? Most common ones, like, there's no point in exercising because I'm already getting old. I don't have too many years to live. Why should I exercise? I'm not young anymore. Next is, I'm going to go get old anyway. Elderly people shouldn't exercise. So there is a strong myth also that exercise is not meant for the elderly, it's just meant for the young people. It's nothing like that. Next is, they should save their strength and rest. They feel that if you exercise, it consumes a lot of your energy. So why to do exercise and get tired and later feel lack of energy? So instead of that, better rest, because at this age, I should rest. I have done a lot of work in my younger days. So it should not be like that. Yeah. So next is exercise puts me at a risk of falling down. So many people who have balance issues already, who are suffering from balance issues because of various reasons like old age, or even being suffered from stroke, paralysis, or Parkinson's. There are so many conditions which affects you, especially in the later ages. So they are at the fear that if I do exercise, I'll fall and later I'll have other issues. So this is one myth that they have. Next is it's too late. I'm already too old to start exercising. It's never too late. I personally know many senior citizens who has started exercising at the age of 80s, 84. I know a person who was at his 84s when he started with the cardiac rehabilitation, and he wanted to improve his endurance and strength, and used to do everything: treadmill, cycling, lifting weights. He was doing everything, provided it has to be done under the supervision. And the next one is I'm disabled, I can't exercise sitting down. So there are some of you who might have some medical concerns because of which you cannot stand or you cannot walk too easily. So you are confined to a chair mostly, or to a bed. So for those people, they think that I can't exercise because I can't stand, I'm disabled. It is not so. Even in sitting position, even in lying down position, there are many exercises that can be done. And doing this exercise in the long run will actually help you to start sitting, start standing up, start walking around also. So exercise really helps. Now, there are many age related changes in the body. See, aging is not unusual or nothing, wrong. It's a normal aging process. As we age, our body also age with us. So our skin changes, our hair changes, there is internal bony changes. There are certain medical conditions that affect us because of age. So some of the most common age related changes in the body with over a period of time that we see is cardiovascular diseases. So it affects our heart health, because what is a heart? Heart is nothing. Heart is also made of lot of muscles. So when we grow old, the way the muscles of our body get weaker, same way our heart muscles also get weaker. Now, what is the solution if the muscles of the body get weaker? How to strengthen them? With exercise. Similarly, if you have heart related ailments, that also can be strengthened with exercises. Not just strengthening part, let's say, I will not talk about only cure part, I will talk about the prevention part also. So if you are always active and into exercise, you can prevent heart related conditions. Cerebrovascular diseases, stroke is one of the most common issue these days that we are seeing in a lot of people, especially the elderly, which makes them weak or paralyzed in one side of the body. It affects their gait. They're not able to walk, they get confined to a wheelchair or a walker. So these all things can be prevented with exercise. High blood pressure nowadays, even younger generation people are suffering from blood pressure related issues. So but it is also something which happens normally when you age. Dementia, so kind of memory loss, you feel that, see, normal memory loss and a dementia, there are two different things. Simple normal memory loss is also very common, because when you age, there is shrinking of the cells in your body, because of which the skin will form wrinkles. Same way in the brain also, there is degenerative changes. Certain areas on your brain that is responsible for the memory, that gets affected. So for that reason, some people, they feel that the memory has reduced when they're aging. So it is one of the normal aging factors. But again, when it comes to dementia, that's a medical condition which needs more intervention. Parkinson's disease also is one of the common complications seen in the elderly, which affects their balance, their strength, their coordination. Even for reaching out for a glass of water becomes difficult for them. The hand will shake and there's a lot of tremors. Chronic obstructive pulmonary disease, that is any breathing, lung related problems when you age, because the lungs become weaker. So you might have a lot of breathing issues also, COPD and other stuff. Osteoarthritis, again, arthritis is nothing but degeneration of your bones. So the way when you age, your skin changes, your hair changes, internally your bones will also change. There will be wear and tear of the bones. That is only arthritis. So it's a normal aging process, it's not a disease. But this aging process, for some people it will be faster, for some people it can be slowed down. So if you are active and if you exercise on a regular basis, you can slow down this process of arthritis. Generalized muscle weakness, as you age, you will have a lot of muscle weakness in your body. And balance problem. Balance is one of the major concerns why many elderlies in their later ages, they because of balance problem, they get a fall, they have a fall, and because of the fall they end up with some fracture. For example, hip fracture is very common because of a fall, and they become bedridden. Once they become bedridden for a prolonged time, their lungs get even more affected, and breathing issues come, and that's when things go on the downfall. So these are most common age related changes in the body that we see on a regular basis. Physical health benefits of exercise for seniors. Now, should you exercise? Should you not exercise? The answer is yes. But why should you exercise? What are the benefits that you can get when you exercise? So, exercise helps seniors to maintain or lose weight. So, either you can maintain or you can lose also. There are some of you who are actually having less weight. You need to gain. So, it helps to build muscle mass also. So, that way you are in an optimum BMI level. Exercise reduces the impact of illness and chronic diseases. For example, I just now explained, for example, arthritis or any degenerative changes or any lung related problems. So these are not diseases as such, these are aging process which impacts our body. You see some people are there who are quite young but they look very old, and there are some people who are quite old but they look quite young. So this, why this happens? It happens because there are many factors: modifiable factor, unmodifiable factor. So unmodifiable factor is your genes, your hereditary roots, which we can't do anything. But what are the modifiable factors? Your lifestyle, your food eating habits, your exercising habits, stress. There are so your work habits. There are so many things that can be modified. When these things go wrong, for example, if you're not very active, you don't exercise, you're mostly living a sedentary lifestyle. So what happens? The aging process goes faster. So the degeneration also starts faster, and you end up with chronic diseases like arthritis, COPD, degenerative changes, etc. So exercises reduce the impact of this illness and can slow down your aging process and can help you maintain a fitter life. Exercise also enhances mobility, flexibility, and balance in seniors. So I spoke already about the myths. After that, I progressed to age related changes in the body.
Right. Go
Okay.
ahead. Go ahead.
Yes. So there are different changes in the body that is related to age that I already explained. Next, I was in this slide now, which is physical health benefits of exercise for seniors. Is it visible?
Yes, it is.
Okay. So I was talking on this slide right now. So I'll continue. Okay.
Yeah.
Yeah, so I was talking about the health benefits of exercises for seniors. So when the answer is should you be exercising at an elderly age, the answer is yes. If the answer is yes, why so? What will be the benefits? So I talked about the weight part, I talked about the impact of illness and chronic diseases. So next is it enhances mobility, flexibility, and balance in seniors. So I have also explained in the previous slides that balance is one of the most common factors that affects seniors during the later ages, and the chances of fall is high. And again, because of a fall, they end up with other complications, which reduces the life expectancy. So exercises will help to improve your balance, and it will work as a prevention to safeguard yourself from falls. So falls is one of the major concerns in senior citizens. Exercises, again, everybody knows, helps to improve muscle strength, helps to improve endurance, helps to improve cardiovascular health, and helps to maintain blood pressure. So at a later age, I told that your heart is made of several muscles. So the way when you exercise, it helps to strengthen the muscles. Similarly, the exercises also helps to strengthen your heart muscles as well. So this will improve your heart health. So when heart health is improved, again, along with exercises, it helps to control your cholesterol level and other factors, because of which it helps to maintain a normal blood pressure also, because hypertension or BP related issues are very common again for the seniors. So the previous one we saw was the physical health benefits. Those were the physical health benefits. Apart from the physical health benefits, what is the other benefits? It's the mental health benefits. Okay. So when you exercise on regular basis, what happens? There are a lot of hormonal changes in your body. Good hormones are released, because of which what factors are affected? It improves your sleep. So not only just hormones, when you work out through the day, you are using your energy levels, the muscles are getting workout, so they go into fatigue, so there is a sense of tiredness, so this helps to make you fall asleep faster. So it definitely gives you a good and a sound sleep. Exercises boost mood and self confidence. Again, when the good hormones are released, you feel ki yes, I'm strong, I am fit, I am doing well. So it will give you a self confidence ki yes, even though I am a senior citizen, I am supposed to be an old person, but I am not less than any younger person because I know I am physically strong. So that gives you self confidence, and it automatically enhances your mood also. Exercise is also good for the brain. So as I said in the starting of the session, that when you exercise in older ages, what happens, the way our body changes, the muscles become weak, the skin changes, the hair changes. Same way our brain will also undergo some sort of degeneration. The neurons in the brain, they go into shrink, they shrink up, so it affects our brain also. But when we exercise, it improves the blood flow and it keeps us more alert. So that way it improves our brain functioning also. So problems like memory loss, feeling lethargic, feeling like lost, feeling like being in a different world, and having the depression thoughts, everything reduces. Helps to prevent memory loss, already I have explained how it does. Reduces the brain degeneration, again the similar lines, that when you exercises, so your brain cells don't shrink up easily because the blood flow is increased, hormones are released, you are getting fit and active, so that way it improves the brain health also, so the brain doesn't degenerate so fast. Gives a sense of well-being and happiness. So if you are fit, you are strong, you are not dependent on anybody. The moment you become old, your muscles become weak and you start becoming dependent on someone. Either it can be a dependency on a walking stick, it can be a dependency on the wheelchair, you might get bedridden, and then there's a dependency comes where you need a caretaker to look after you. Even going to a bathroom becomes a challenge. Holding of urine becomes a challenge because you feel there is incontinence problem, because the moment you cough or sneeze, there might be leakage of urine. Or if there is an urgency, strong urgency to pass urine, you cannot hold because your bladder muscles have become weak, so you need to wear a diaper. Then what happens, you become socially awkward, you feel shy to mingle with people socially because you are using a diaper, or else you are using a stick. My own grandmother, she used to feel shy to use a stick when we used to have a visitor or she's going outside. It used to make her feel socially awkward. So these are the things that happens, but when these factors are kept away, you don't suffer from these factors, so you feel a sense of well-being and happiness. So exercise helps in all this in mental health benefits. So, senior exercise and fitness tips for getting started. So, as you say, ki, okay, I have not been exercising, I want to start exercising. Should I get started? Yes. So, before you get started, what are the things that you should keep in mind? First is get medical clearance. Some of you might have certain ailments because of which exercise may be limited, or the exercise plan has to be formed in such a way that it should be very minimal and very light intensity for the time being, and later we can increase. Or there might be some medical issues that might not immediately allow you to go ahead with the exercises. So before you start off with the exercises, once you get a medical clearance, maybe you can go for a health checkup also. So there are many health checkup options available for the seniors. So they make packages which involves tests and investigations, which is meant specially for the senior citizens. So get that done, it puts you on a safer side. Consider health concerns. You will also have to see certain other health concerns that is actually stopping you from moving out. For example, if you are there are patients who a few years ago had a stroke attack, because of which one side is partially weak. So getting up and from the wheelchair or stepping out from the house might be a challenge. So you have to consider your health concern in that way. So at that time, maybe you might not go to a clinic or a gym or any other exercise center for the exercise. That time there are other options available. What are these options? You can set up a gym at home sometimes if it's possible. There are many cost factors comes into the picture, like you can have a treadmill, you can have a static cycle set up at home. If not, other option is you can have home care also. So in physiotherapy part of view, we have home care options also, where the physios come to your home at the comfort of your home. They make you do a lot of exercises, so that way health concerns that stops you from stepping outside your home still at home itself you can get the exercises done. Start slow. Remember, don't get over enthusiastic. Sometimes we are not at all enthusiastic, we don't want to exercise, but when sessions like this is done, you suddenly feel one day, okay, I should tomorrow only go and start doing exercise, let's go to the gym and start doing. So you get over enthusiastic, and then you start doing more than what is needed. So always go slow. If you are a person who was never exercising earlier and you want to start, so when you start, you should not start suddenly with a high intensity, exercise plan. You should always go ahead slowly with low intensity, and then slowly, gradually progress. Recognize the problems. So when you come to a healthcare person, especially for the exercises, it is important that you understand your own issues, your concerns. Balance is your concern, weakness is your concern, memory loss is your concern, joint pain, stiffness is your concern. Whatever concern is, you should recognize your problems before you start off with the. Obviously, when you anyways go to a healthcare professional, they do their own they do their own assessments, and they try to understand your concerns. But it is also important that you should know your limits and convey this properly and clearly. This helps to make a proper exercise program. Plan and start. So once all these things are sorted, okay, done, got a medical clearance done, your health concerns are taken care of, you can't come home, you can't come step outside, you got a home care person coming there doing exercises for you. We start off with a low intensity program, gradually increasing. We understood what are your problems, so this is properly planned, and then we start. So this is how you should get started on the first place. Tips to build a balanced exercise plan. First building block is your cardio endurance exercise. So as I said, so exercise for the muscles of the heart. So if heart is strong, your endurance will be higher. Not only the heart, even the lungs also. So it goes into cardiopulmonary together. So both are kind of similar, where we include lot of endurance exercise that is meant for your heart muscles as well as for the lungs as well. So this increase both your cardiac part as well as your pulmonary part. So once your endurance improves, then it is easy for you to do more further progression in the exercises. Second building block is a strength training. Okay, so at the later ages, for the elderly, muscles become very weak, so you are not able to, sometimes even if you're sitting in a chair for a long time, getting up from the chair also becomes a problem because you're too weak. Some of them are even using walkers. So when you're walker using walkers, sometimes the walker will also have its own weight, so you have to lift the walker with your hands. So if your upper body, your hands are not strong enough, that time we can't even teach the patient walk using the walker. They become dependent on the wheelchair only. So the progress from the wheelchair is always using the walker, and then after few days in the walker, then we stop the walker, we switch to the stick, and then at the end without the stick. But to progress from the wheelchair into standing with the walker and walking, you need to have strength. So this is just an example why strength is also important to be mobile and moving. Next is flexibility. So it's always important to have a flexibility in your body. Many times we see when there is no flexibility, people end up with lot of spine related concerns like back pain. Majority of the time the back pain is because of the tightness of the muscles. The muscles are not balanced, your core muscles are not balanced. One group is tight, the other group is very weak. So you need to balance by stretching exercises. So flexibility is important. The spine needs good flexibility exercise. Even your hip joints, some people will have very tight hips, they will have tight hamstrings. Hamstrings is the muscle which is in the backside of your thighs. Having tight hamstrings will lead to back pain also, will lead to knee pain also. So we need to stretch all the tight muscles to take care of pain related part in your body. So there are certain areas, it can be your spine, the shoulder. Many people will have frozen shoulder, so the joint becomes very stiff, they are not able to lift the hand. So the joint becomes stiff, along with that even muscles also become stiff. So when we treat, we have to concentrate on flexibility part also to take care of the pain related concerns. And balance, as I have already maintained from the beginning, balance is a concern, big concern. So balance can definitely be improved with balance exercise. So one of the exercise that you're seeing in the picture itself is one of the exercise that helps to strengthen your lower body, as well as it helps to improve the balance also. So safe exercise for elderly population. What are the different kinds of exercise? It always should be a combination of aerobic and resistance or strength training. So first we start off with a moderate endurance exercise. Some examples like brisk walking on a level surface. Why a level surface? Because when you get older, your joints go into wear and tear. There might be arthritic changes. So when you walk in too much slopey areas, the load that falls on your knee is high. So for that reason, you need to walk on a level or a flat surface with proper walking shoes. Swimming can be done, yes. At an elderly age also, swimming is a very good exercise that you can do. If you have swimming, if you have pool in your apartments, then you can get enrolled, preferably if the water is temperature controlled. You can definitely go and learn swimming. If you already know, go ahead with the swimming part. It will help you to a great extent. Gardening can be done, cycling can be done, stationary cycling, okay, or even a bicycling can also be done on a again level surface. Avoid too much slopey areas, because too much slope means you will need more endurance, you will get breathless and tired. So when it's a moderate endurance, you should go on a flatter surface. Vigorous endurance exercise like climbing stairs or hills. I personally have a patient of mine who had undergone a knee replacement surgery, TKR surgery, at the age of 65. And after that, post rehabilitation exercise of 3 4 months, he also went for trekking. So, trekking, you have to climb uphill. So, he went for trekking also because he was exercising on regular basis. His endurance was also very good. Brisk bicycling uphill also can be done. Once the moderate endurance is covered, your endurance is improved, then in the vigorous is a progression. So there you can go ahead with uphill bicycling also. Jogging is a good option provided you don't have knee related concerns. If you have severe knee pain like osteoarthritis, then avoid jogging, just stick to regular walking. Digging holes is a kind of gardening where you do a more vigorous form of gardening, where you use the spade and you do digging, because that time you become more breathless. So it gives you a little bit more endurance and strengthening. Flexibility and stretch. So shoulder and upper back stretch, hamstring stretches. I already told you which is the hamstring muscle, the muscle behind your thigh. Abdominal stretches, your abdominal muscle. Neck stretches. Because when you become older, your upper body, your neck spondylitic changes, your shoulder becomes stiff, knee pain is there. If abdominal muscles are weak, spine problem will also come. So all these are important when it comes to flexibility and stretch to take care of your pain related concerns. Balance exercise, simple example like standing on one foot, walking heel to toe. So you have to walk on a straight line where one feet will be back, the other feet will be in the front. The front feet heel should be touching the toe of the back feet. So you have to walk in a straight line with a heel to toe pattern. So this is a very good exercise. It's called as tandem walking. You can stand also in that position for some time without holding. This improves your balance. Balance walk. There are many other options, exercises which we make you walk, where we challenge the balance, and you have to walk in that way. It improves, it strengthens your whole core muscles and improves your balance. Hand or finger exercise is also required. Next is strength and resistance training exercises. Push-ups, lifting weights, dumbbell and theraband exercises, gym training, aqua or hydrotherapy. Now this goes into the later phases. Once you have done the all other things, slowly gradually you have progressed, you have good strength now enough, then you can go ahead with a progression which goes into strength and resistance training. So push-ups, lifting weights, dumbbells can be used. Obviously not as very high, because when you get older, your bones will lose the density, so it become osteoporotic. So not too much heavy weights. 2 to 3 kg, start with 1 kg, then go ahead with 2 3 kgs, up to 5 kgs is also fine. But if you have been trained in gym for too long with a trainer, then you can go beyond with supervision. What theraband also, as you can see in this picture, you can see the lady, she is having an elastic band and she is pulling. That is called as a theraband. It gives resistance when you do exercise. It helps to strengthen your muscles. Gym training also, yes, I will talk about that. And aqua and hydrotherapy. So when I talked about swimming, what you have in your apartment as a swimming pool, that is free swimming. But what you do in clinic, or there are certain setups where they have aqua or hydrotherapy, where they specifically train the patients and teach exercises inside the water. We will give weights inside the water, we will teach relaxation exercises, we will make you do a lot of other exercise in the water. That is called as pool therapy. This is also one of the options. and other relaxation techniques like yoga, meditation, breathing exercise can be very safely done, and it is very good for your health. So I'll not go much deep into all this. So doing exercises helps to increase few things, improve few things, reduce few things. Okay, so blood pressure reduce, abdominal fat stores reduce, risk of fall reduce, bone mineral density increase or maintain, even triglycerides, sugar, everything reduce. Okay, oxygen consumption rate increase, metabolic rate increase. So good things it increases, bad things it reduces. Okay, so strength increases, abdominal fat stores, flexibility, risk of fall, muscle fiber size, everything. Good part, everything increases. Bad part, everything reduces. So, is gym safe for the elderly? So, this was one of the factors that was told to me to take up during this session. This was one of the concerns of quite a few of you. Is it safe to go to gym if you are an elderly person? The answer is yes. It is safe to go to a gym for the elderly, provided there are few terms and conditions that should be kept in mind if you want to go to a gym. What are the terms and conditions? Proper health checkup to be done prior, which I have already mentioned in the previous slide. Do not go without a proper health checkup. The gym that you are going must have a proper trainer. There are many gyms who do not have proper trainer. Some trainers in some gyms are not even licensed. They are not even skilled. They just hire one person with a limited knowledge just to show that they have a trainer. Make sure which gym you are joining, whoever trainer they have, make sure that they are well certified person. They are aware of different medical conditions. You should always go to that kind of gym only, or any gym without trainer, please avoid. Go slow and steady, as spoken earlier. When you go, don't be over enthusiastic with the fact that you are starting a gym and you will feel ki, okay, let's do a lot today. First day itself I will do 100 repetitions or I will do 50 repetitions. Avoid. So when you start newly, remember the muscles go into soreness. If you do too many repetitions, the next day your muscle will become so sore that you won't be able to even get up because of the soreness and pain, and it might lead to some form of injury also. So go slow and steady. Avoid being over enthusiastic. Don't compare with others. So if you're in the gym, there will be many other people. There will be some youngsters, there may be somebody who's almost same like your age. So you cannot compare with them. Okay, see, this person is almost similar to my age, but see how well he's doing, see how much weight he's lifting, see how many repetitions he's doing. Maybe he is there in the gym much before than you, so he has been doing it from a long time. Or else maybe physically he is, or medically he is more fit than you might have a certain medical condition that he doesn't have, so he is doing more than you. So do not compare with others. Work only on your requirements. What is your requirement? That is important. Have you come here to lose weight? Have you come here to improve your cardiovascular strength, your endurance? Have you come here to improve your balance? What are your requirements? Focus on your requirements mainly. As far as that, discuss it with your trainer, and then let the trainer make a exercise protocol or program for you where you can safely start, and then progress gradually. So first few days you started with low intensity, then you go with mid intensity, and then you go with a high intensity with the clearance from the gym trainer. And also keep regular in touch with your physician. So anytime if you have some discomfort after the gym, if it is mild, goes the next day or in 2 days, it is fine. But if the discomfort is too severe, or it is not going even after 2 3 days, then it is better you reach out to your physician. So always keep in contact with your physician on a regular basis. If all these factors are sorted out, then yes, it is safe to go to a gym for the elderly. So exercise without worry. What are the things can be done for the elderly, and what we at Physiotattva are also doing for the elderly? We have aerobics training. You can enroll anywhere else also if you are from a different part of Bangalore. Currently, we are providing in Bangalore and Hyderabad. But if you, we have 21 centers in Bangalore and 3 in Hyderabad. Sorry, 17, 18 in Bangalore and 3 in Hyderabad. So if you are staying in these places, you can reach out to us. If not, you stay in other place, there are many physiotherapy centers which can help you out with different exercise programs for the elderly. What are the different kinds of exercise program available? There is aerobics training, there is strength and resistance training, cardiac rehabilitation for the heart, especially pulmonary rehabilitation for the lungs. There is geriatric group therapy sessions also. If you are not very comfortable doing the exercises alone, you want to mingle with people around your own age. This also gives you a break from staying inside the house only and meeting similar people. So you feel good talking to them. Socialization also happens. Aqua therapy for the seniors. So as you can see in the picture in the below, in the pool they are doing together group therapy for the seniors. You can see there are many props like this that acts as weights or give resistance inside the water. It helps in great strengthening of the body. Neuro rehabilitation for the seniors. If you are affected by any neurological condition like Parkinson's, stroke, or any other nerve related condition where you feel your balance is affected, your body is becoming.
I think we've lost your doctor. Connection is frozen.
Where too
Yeah.
much of excessive body weight is coming on the knees, or certain areas getting too much strained out, avoid those asanas. Apart from that, do.
Thank you.
So
Thank
this
you very
was
much.
entire to covered the possible conditions that affects you at a particular age. So any questions related to the entire session? I hope it could clarify many doubts that you had. But in spite of that, if you still have doubts, please you can feel free to ask.
Yeah. Can you hear me?
Yes.
Okay. There are quite a few questions that have come in, but we don't have too much time.
Yes.
Uh, so let me take this question about from Sunita Verma. Can a daily household work schedule, like watering the plants, dusting, etc., replace a daily workout?
No. So I'll tell you one thing. If that would have been considered a daily workout, then why there are so many women who come to us as patients? There are many housewives, especially, who are coming to us with lot of pain in the body in various areas. They are doing all household works. So if that is an exercise, why they are becoming patients? So no, you cannot replace exercise with daily household
Right.
chores. So household chores is a different thing. Exercise is a different thing.
We have a question from P. Kudambra Babu. What is the best time for exercise?
Okay.
And then
So best
another question, which is from Anupama Singh. Being from North India, where temperature varies from 2 degrees to 48 degrees, winter to summer, would you advise the time?
Okay. So ideally, when you ask the right time for the exercise, they always people will suggest early morning or in the evening. The reason is the temperature. So normally in places where the temperature is too high, it gets on the higher side. So morning the temperatures will be less, and the evenings the temperature will be less. But if you are staying in an area in a place where the temperature goes to extremes in the morning and evening, if you feel the temperature is lesser or comfortable in the mid part of the day, you can do in the mid part of the day also, not a problem. There is no fixed rule that you should be only doing it in the morning or evening. Depending on the temperature, avoid doing exercise at the time of the day when it is too hot or it is too cold. Okay, so apart from that, it can be done. Only keep in mind, if you're doing in the midday, don't do the exercises immediately post a heavy meal. If you had a heavy meal, try to give a break of at least 1 hour. If it's a heavy meal, light meal means half an hour to 45 minutes, heavy means 1 to 2 hours break should be there.
We have a question from Rajendra Shah who says, I'm physically challenged. Will running a tricycle help as an exercise?
Not a tricycle, because tricycle is meant for kids. You can definitely go ahead with a stationary bicycle. The ones that you see in the gyms and all, it is static, it is not moving, so you have to comfortably sit and exercise. Now the problem with the gym exercises, gym cycles, are the seats are like a normal bicycle seat, so they do not have a back support. But if you go to any medical gym, any physiotherapy center, or any place where they have a medical gym, they will have static cycle where the seat has a back support, so you can easily sit there and you can do cycling. It will help you.
Right. We have a question from Bomi. Says, Doctor, my husband, age 79, had a fall and has a partial hip replacement done in November. Can he squat down maybe after a few months, or it should not be tried?
Okay, so after few months, after let's say 3 to 6 months, he can, but only partial squat, not beyond. Because after the hip replacement surgery happens, there are certain limitations. Earlier, it was a lifelong no, or you can't do at all. Nowadays, with the new implants, new quality implants coming up, so there is little, relaxation in the rules. So yes, he can do partial squat, but not full squat. And sometimes the way also you do squat matters. People usually do squat in a wrong way, provided you know the correct way. And partial is okay, it should not go too much, not too down, it should not be too full squat, it should be half squat.
There's a question from Arti Ghosh who says, I've had a hip replacement. I cannot walk properly. Please advise what exercises can I do with ease?
Okay. So usually after hip replacement, I hope you have also gone for a rehabilitation program, that is physiotherapy, because many times if proper rehabilitation doesn't happen, what happens, the whole surgery becomes a failure. So post surgery pain, difficulty in walking will be there for some time. It will take 2 3 months for you to become normal. If proper rehabilitation not done, it can go more than 2 3 months also. So there are many standing exercise, holding somewhere for support. In standing you can do leg lifting, front ways, sideways, back ways. Lying in the bed also you can do leg lift, front, sideways. The same exercise can be done using weights also. You can go for regular walks. Make sure it's a flat surface. The best part will be to look for a very good qualified physiotherapist who will be able to help you with further exercise, because in this platform it's not possible to tell deeper so much into exercise. We have to assess the patient also, but yes, with exercise and proper rehabilitation he can become full normal.
Thank you. We have a question from Kiran Kapadia who says, my shoulder is fractured in October 2024. The pain is still there. What is the suggestion, I guess, in terms of exercise or physiotherapy?
Okay, October, November, December, January, and now we have turned into Feb. So we are almost entering 4 months. So post fracture, after the fracture, they will keep you in the sling. So they will, put you on a sling. If I'm not wrong, the same thing has been done. So when you are in the sling for at least 4 weeks, 3 to 4 weeks for the upper limb, they'll put you on a sling. So you're not moving the hand at all. So this will make the joints stiff. So once the joints become stiff, it is very important to again start with physiotherapy, where they will do exercise to reduce the stiffness. And there are many manual techniques. Manually, the physio will do, we call as mobilization. So the stiff shoulder has to be mobilized by the therapist using many manual techniques that will help to reduce the stiffness. Along with that, proper exercise. It may take 2 3 months time with proper exercise to get the full range. Until and unless full range doesn't come, pain will be there. So you should compare your progression, how much you're able to lift your hand better, rather than comparing with the pain. Pain will go when full range comes. But yes, this also can be sorted.
Doctor, two more questions. One is from Rani Shekhar, who says, Doctor, my RA test, uh, uric acid test, etc., are normal, but I still have pain in my hands and fingers. Is that something that she should be doing?
When does the, see again, these are the things where we have to physically assess the patient, understand few things like, when do you get the pain usually? Do you get it early in the morning when you wake up, or you get it throughout the day? What are the activities that you do? Do you do that kind of work where you need to do lot of finger and hand movements, any keyboard, too much of keyboard usage, mouse usage, or any lab work you're doing? The work has to be first properly understood. The time of the day when you get the pain, that has to be understood. We need to check if there is any stiffness. Have you recovered from some injury earlier? There are many questions that first I need to get the answer to. And sometimes the RA test, it comes negative, but that is sometimes a false test which needs to be retested again after a particular few days. That gives a correct result. So if you have already done, how many days ago you did, if it's some time has passed, I will suggest that one more time you do it. So there are certain factors which needs to be looked upon. And also I will suggest that you personally physically visit a physiotherapist who will be able to guide you on this, because without seeing you I will not be able to completely comment on this part.
Right. You mentioned about the certification that you should look for in a trainer, etc. So, what is the kind of certification one should look for?
Okay, so there are some trainers in some gym that they hire physiotherapists. Okay, some trainers are physiotherapists, some trainers are not physios, but they have undergone diploma courses or some certification courses into fitness and workout. So when they go on to those courses, during that training program, they are also taught about some medical conditions that should be careful. They should be careful about while making the patient do the or the person do the workout. So there are certain gyms that are hiring undergraduates. That means if it's a physio also, the physio has not finished his graduation. They're still in their first year, second year, third year. So that you need to clarify whether it's a complete graduate physio who is a licensed graduate physio, or if it's a
So let
different
me just
trainer.
get it clarified for our for the people who are there today. What you are recommending is go to a gym, etc., where the trainer is a physiotherapist, a
Not
certified
necessarily.
physiotherapist.
No, not necessarily a certified physiotherapist. If they are having the trainer as a physio, you have to make sure that the physiotherapist has finished his graduation. If the trainer is not a physio, the trainer might be not a non-physio, but they are trained, they have certified, they have undergone certified courses in fitness. So you
Right.
have
So
to.
which is the certification body that one should look for?
I am not very well about the certification body, to be honest. So I'm sorry in this matter. I'll not be. There are many bodies. There are many places in different areas. There are different places. So that gives you a certification course, because in during that course, whether it's a diploma also, they will guide you about the risks, the inclusion criteria or the exclusion criteria, the red flags. If a person is exercising in the gym, if you see the symptoms, the person has suddenly become very breathless, or it is he's sweating excessively, and along with that he's breathless also, he should be capable of identifying whether it's a red flag or whether the swelling or the breathlessness is just because of a rigorous workout. He should understand those parts, so that only a trained gym trainer can do, not a fake one.
Right. That's where there is a bit of a gray area, I think. I'm not very sure because, there are gyms and gyms and gyms, and there are several trainers there. The question
Yes,
is, who's a trainer who's
I'll tell you
trained
one
enough.
one simple trick. I'll tell you. See, when you go to a gym, you will just ask, do you have a trainer? They will say yes, and you just, okay, fine, you have a trainer, let's go ahead. Instead of doing that, if you show little concern, ki I am a senior citizen, I have certain health concern, make sure you are providing me the most senior most trainer, or I want to see the certificate of the trainer. They will definitely show you whether they have a certificate, or most of the times they do. If not, they still become aware that you are a person who's very very particular about the trainer that they are providing. So to make sure, they will give you a best trainer they have. And if they're having only one gym trainer in the entire gym, and there are too many people, you have to be aware. Make sure you look into the certificate, you insist on looking at their qualification, what qualified they are, whether they have done some fitness training course or not, or whether they are a physio or not. At least that part you have to make sure that you are telling them, that it has to be clarified. Many times in our profession, when our physios are going at home for certain patients home treatment, they ask for the qualification of the physios. Sometimes we do provide, so it is mandatory if you are concerned about your own safety and well-being.
Right. Thank you very much, Dr. Dharitri Brahmbhatt, for this session, and thank you to your team to having facilitated this. We will be back again next Saturday at 5 p.m. for another session of Health Live at Seniors Today. Do remember that you can pre-register for the health webinars. You must also uh, check our Evergreen Club shows that are there through the day, morning, afternoon, and evening, as well as the Seniors Have Talent has started once again, the 17th season. In fact, we've just had a third round of that, so it's been a while since it started. And of course, our daily website is there, and the Seniors Today magazine, which is the January issue, has now been there for a while, and we are working on the February issue. So uh, uh, enrich yourself and do access the various things that are there on on the Seniors Today platform and Evergreen Club, and have a great weekend. Thank you very much once again, Dr. Brahmbhatt.
Thank you so much for having me here. I really feel honored. I hope the session was insightful and it could help you clear your doubts.
Yeah. Thank you very much. Yes, it did initially. It did it quite definitely. Unfortunately, we couldn't answer all the questions, but your presentation was fairly exhaustive and it kind of addressed most doubts. Thank you.
Thank you so much.
Subscribe now and press the bell icon. Never miss an update.